Hi.
Born in India and raised in America, Dr. Batswati Bhattacharya consults patients in her New York City practice.
I'm Dr. Dinacharya.
Though trained in Western medicine, Batswati is among a new breed of healers.
Okay, just say ah.
She is looking for alternative approaches in treating disease beyond the boundaries of conventional medicine. Her search is taking her back to India,
Taxi!
where she will further her research into a unique system of healing. Though healers have used it to treat some of mankind's oldest diseases, relatively little is known about the Ayurvedic tradition of India, where it is widely used in everyday life. In recent years, however, Ayurveda has been gaining ground beyond India as a philosophy, lifestyle, and healing system. Scientists are now taking a closer look to better understand how Ayurveda works and the promise that it may hold for the future. In her ongoing research, Batswati is one of several doctors who are trying to bridge the gap between the East and West. Her aim is to find ways to integrate Ayurveda's methods into modern science.
Being a doctor and a healer myself, I feel that I need to understand the medical systems in other countries. And this time I wanted to see what is referred to as the authentic Ayurveda. I also would like actually to find some cures, if possible, for a few of my patients where the allopathic treatments have basically not been working. And I have heard of cases where patients have come to India for Ayurvedic cures and have found things that work.
What strikes me about Ayurveda is that there is a science. It may not be the same science as modern medicine uses. It may not be the same language, but there's definitely a science in Ayurveda which is precise and has a basis that has been clinically proven over thousands of years. If it didn't work, people would have stopped using it. And what is fascinating to me is that there are so many diseases which are classified in very similar ways as modern medicine does. Different types of cancer, different types of autoimmune diseases, diseases of the heart, diseases around pregnancy, which are extremely well categorized and classified in a way that the modern medical doctor could actually use them. The Ayurvedic doctor uses the tongue or urine diagnosis, looks at the skin. These aren't things that a modern medical doctor doesn't do. It's just that the modern medical doctor hasn't been taught to put as much emphasis on it. In fact, there are a lot of things that modern medical doctors can learn from Ayurvedic doctors. What's cool about Ayurvedic diagnosis is that there is a large body of evidence showing that you can correlate things that you see on the external physical body with what's going on inside the body. Isn't it cool to be able to look on the surface, to know the book by its cover? To be able to look at a body and say, I can tell you what's going on in your inner organs, and not only what's going on with which organ, but how seriously and how deeply the disease is set.
Asheshakaya prasrdan asheshan vayuh pittam kapashchedi trayo doshaha samasatah.
Dr. P.K. Warrior is one of Ayurveda's most respected healers. By chanting the verses of the Charaka Samhita, one of Ayurveda's oldest texts, Dr. Warrior preserves the crucial link between past and present, keeping the Ayurvedic tradition alive.
Hello.
Good evening, doctor.
Namaskar.
Now, this is the Grantham.
The Charaka Samhita was written around 800 BC and contains words which predate the Hippocratic Oath. Day and night you shall endeavor for the relief of the patient with all thy heart and soul. All Ayurvedic practitioners are reminded of this precious heritage when they recite these words, written in the form of hymns which yield the foundation of medical knowledge.